Welcome to our workshop where we are going to talk about culturally relevant care for South Asians living in Canada. My name is Mahit and I'm one of the research assistants working with the lab. And today we have here with us Gurkirat Singh and Kulpreet Singh from the Students Overcoming Substance Use Disorders and Addiction Society of Canada. In this session, Kulpreet Singh and Gurkirat Singh will discuss their organization's initiatives. Kulpreet will highlight how SAMA organizes mental wellness retreats and training programs for South Asian youth, empowering them to actively promote mental wellness and reduce stigma through a new mental health youth ambassador program. Gurkirat will share his journey from encountering an overdose incident to founding SADA, again, the South Asians living in Canada, overcoming substance use disorders. He will delve into SADA's effort in setting up drug poisoning response booths, offering naloxone training, and connecting individuals with culturally relevant services. Additionally, we'll have Gurkirat discuss stories from SADA's case management team, shedding light onto the experiences of South Asians impacted by the overdose crisis and aiming to inform better care solutions. So now I will give the floor to our wonderful presenters today, Gurkirat and Kulpreet.
Hi, can you turn on the screen sharing so that I can share my screen? Thank you.
Also, before we start, I want to remind all the individuals attending that we will save the questions for after the session. So feel free to put all the questions in the feed loop platform.
Hello, everyone. My name is Gurkirat, and I am founder of Students Overcoming Substance Use and Addiction Society of Canada. And alongside me today, we also have Mr. Kulpreet Singh, who will be presenting as well. He's founder of South Asian Mental Health Alliance. Kulpreet Singh, would you like to begin giving your brief intro, and then we can segue into different parts of our presentation?
Absolutely. Thank you, Gurkirat Singh. So thank you for having us today for this session. My name is Kulpreet Singh, and I'm the founder of the South Asian Mental Health Alliance. Before I begin, I'd like to offer an acknowledgement. Gurkirat, if you could go to the next slide. We'd like to acknowledge that the lands on which we work, play, and learn are on the unceded, shared traditional territory of the Katsi, Kwantlen, Semiahmoo nations, and other Coast Salish peoples. I'm speaking in reference to the lands that we are presenting from, and I welcome others who would like to share the lands that they are joining from. These territories were stolen and claimed by European powers through colonization and the genocide of Indigenous peoples, the consequences of which are not only part of the history of Canada, but continue to persist here and now. And so with that acknowledgement, I also like to appreciate that we have this opportunity to share about the struggles that the South Asian community is facing with the toxic drug crisis, and how we are responding to mental health stigma, and how we are trying to have engagement with the community in early intervention and prevention. I started on this path from my own diagnosis with ADHD when I was 25, and prompted me to start a nonprofit society that would do work within the community in 2010. We hosted North America's first South Asian mental health conference back then. It was in Surrey, BC, and it was widely celebrated by the community. A lot of professionals and a lot of community members attended. And we're going to be sharing about the journey from there onwards until the present day. So in about 2014, we started doing outreach with youth, and we started doing skill building and capacity building. And part of that was training young people in the Canadian Mental Health Commission's mental health first aid training. And what we noticed was that the mental health first aid training was not culturally relevant or language appropriate. And so we started to adapt different trainings, whether it was BCP or support training or suicide prevention training, or as the toxic drug crisis, the emergency was declared, overdose prevention and response training. We had to adapt those to be language specific and culturally safe for South Asian communities. Next slide. So the South Asian Youth Mental Health Ambassadors Program. And from here on, throughout the presentation, Gurkeerat and I will go back and forth. So I welcome Gurkeerat to add on as we go forward. So the South Asian Youth Mental Health Ambassadors Program, the seeds of the program, as I mentioned, started in 2014. And then formally in 2019, when we got endorsement from the Mental Health and Addictions Ministry and funding for the program, we were able to launch it out, and we hosted trainings for local domestic Canadian-born students and also international students. And this program involved trainings, workshops, recreational activities, and just social atmosphere for young people to connect with each other, but also to learn about the things that I mentioned: mental health, crisis intervention, suicide prevention, and also about addiction and substance use. And so as things move forward, we have been engaging in the community in various ways. We participate in community events, we go out to places of worship, and we engage with young people in leadership development. We provided them within the retreats themselves and also within community workshops, skills for them to feel confident with public speaking, for them to feel confident in doing outreach, for them to feel confident in doing workshops and presentations such as this one, and then also for them to be able to affect change within their families. And so some examples of this in the next slide. A couple of our ambassadors from the South Asian Youth Mental Health Ambassadors team went on to establish a women's wellness retreat, and that women's wellness retreat is thriving. There's an entire women's wellness group that hosts wellness circles. They host social activities, and recently this weekend they hosted their first booth at a conference here at a women's event here in Surrey. And so pictured here is Simran, Surat, and Dilpreet. And Dilpreet and Surat attended the South Asian Youth Mental Health Ambassadors training, which went on to provoke them to create their own initiatives. And so speaking of own initiatives, one of the prime examples and the reason that we're here today is Gurkeerat Singh. And I really want to acknowledge his efforts, the inspiration that he took from his experiences, and actually his concern for the community and helping our young people in protecting them, not only protecting and preventing them from substance use disorder, but also responding through a harm reduction approach. And Gurkeerat, if you'd like to take it from there.
Thank you so much, Gurpreet Singh, for this introduction. Yeah, so I can begin. Since today we have our theme that we're discussing stories of people who are impacted with overdose, and especially the families and the patients themselves. So I was working as an international student at a gas station in 2018 when I encountered a first overdose scenario. So in the restroom, a lady overdosed, and I was clueless how to help her, how to provide her first aid during that situation. Eventually, I learned that British Columbia is going through one of its worst overdose crises, and And I started seeing this trend not only in other communities, but also in South Asian community as well. But unfortunately, there were not measures taken to address these problems in my community. So then in 2019, I got an opportunity to attend South Asian Mental Health Alliance's retreat, which was specifically designed for international students. It was a 3-day retreat where they talked about mental health first aid certification, again designed by Canadian Mental Health Association, and also overdose response and prevention training, which was delivered by harm reduction coordinator of Fraser Health, Karen Gibson. And similarly, we have other modules such as gang violence prevention, healthy eating, how to make sure that international students are navigating healthcare system properly. So all those modules were kind of really necessary for me as I was new to this country. But then me and Purpi Singh, we thought that why not we bring this life-saving interventions directly into the community in the form of outreach booths. So what we did, we started going out in the community. We started hosting overdose response and prevention booths in South Asian community centers, in gurdwaras, in mandirs, in mosques, at other places of worship, in community parks, and even universities such as KPU and UBC, where we have a lot of international students. So we established SODA in 2019 in response to the rise of fentanyl-related deaths, which was being mixed into various street drugs, including opium, because opium is a drug of choice for South Asian people. Opium has been used since ages, but people don't know that the opium which they are getting here in Canada is laced with fentanyl, and fentanyl is 50 to 100 times more potent than heroin. So that is why we are seeing this problem really exacerbated in South Asian community. In terms of our service, so our entire organization is guided by Sikh faith philosophy, which emphasizes treating every individual with dignity and respect, irrespective of their background. So we not only serve South Asian community, but also anyone who comes over to our booth. So we try to help them in any way we can. So there was a report from Fraser Health in 2020, which demonstrated that South Asian community was at high risk of overdose. And this was really shocking to us because since when we started working on ground in 2019, we were seeing this trend, but we never knew that this would be that bad. So the drug toxicity deaths, they increased for like but 255% in South Asian community in the Fraser Health region, which is one of the major hubs of South Asian people. And soon we started seeing this trend appearing in news, appearing at social media. Every week we were getting reports of international students dying from overdose or other migrant workers dying from overdose because opium and other drugs of choices, they were laced with fentanyl. So in
I'd like to
response,
add here.
yeah.
I'd just like to add here that as you can see what Gurkeet has mentioned, this report was from 5 years ago. And so in 5 years, there hasn't been an updated report on the South Asian communities being affected by the toxic drug crisis. And this kind of highlights why there's a need for disaggregated race-based data in our healthcare systems. We have been pushing for this, and even this report, they had to use a workaround to look at South Asian names and see which people from coroner's data may have been from South Asian communities that were affected by overdose deaths. So this was a workaround in those times, but currently there's such a big need for disaggregated race-based data when it comes to reporting on health, especially when it comes to substance use disorder and overdose deaths.
Yeah, and in response to this tragic crisis happening in our community, what we decided to do is, first of all, working on ground. That's one of our main things. So we break stigma and we foster community resilience through community outreach. And we equipped vulnerable populations with harm reduction skills and support. So this was something which was people were seeing this for the first time in Gurdwara, in community places of South Asian community, that people were doing naloxone trainings, people were learning how to save someone. And all these trainings were culturally relevant and culturally sensitive, and in a language which layman, which people can understand. For example, we went to people who do trades, we went to people who do trucking, and we explained them this in a very simple way, in a very easy way to understand. And again, in Punjabi, Hindi, Urdu, and other South Asian languages, so that our message is clear and people can actually learn from these and then use these skills to save other people. And in addition to that, we facilitate access to mental health and substance use resources. So on our community outreach booths, we have young people coming that saying that, okay, so I have been using opium or afim since last many years, and now I want to quit it. I don't know where to go. So we are helping them to navigate healthcare system by connecting them with OAT clinics, with the Roshni Clinic in Surrey, and other resources if we have to. For example, recently, we did small town engagement. So this project was done in Kamloops, Kelowna, and Vernon. So we went to the Sikh temples in these places and we met with the community, and then we explained them what crisis we are going through, and we got a very positive response even from small towns of Kamloops, Kelowna, and Vernon, where we have very diverse South Asian community, and we help people how to navigate the healthcare system in those areas. And what we saw, we do not have enough language specific services outside Surrey, which is kind of concerning. But Singh, would you like to add anything from this trip?
Yeah, I think that this trip was about early intervention. And I mean, of course, we are several years into the toxic drug crisis, but when it comes to stigma and awareness, there's still a lot of people who are not aware of the toxic drug crisis, but definitely aware about substance use disorder and addiction overall. If you could go back to the first couple of slides, Gurkeerat Singh. So what do we do to address that? So one of the things that we do is we are developing resources so that families can have these conversations. So Gurkeerat Singh will be sharing a story about our peer support coordinator, Pravinder Singh, who's pictured in this picture at the back. He has been amazing support to our programs, sharing his life experiences, but he also advised us when we worked with Family Smart to develop a resource. It's a little resource card that will be coming out shortly, in which you can have engaging conversations with your children, but without stigma, and just allowing those safe spaces so that parents can have conversations with their kids. For the next slide, how can we have those conversations within community? So the Women's Wellness Group has created a safe kind of space to have these conversations around mental health, around suicide prevention, but also specifically around substance use and the toxic drug crisis. And then taking that community level approach also into research and knowledge sharing. So pictured here, Gurkeerat, if you could share a little bit more about Avneet's work and the work that's been done with the Step Forward program.
Yeah. So last year, one of the UBC Master's Program student, Avneet Dillon, she collaborated with Soda to develop one of its own kind of program called Step Forward with Soda, where we delivered culturally relevant and language specific overdose response and prevention trainings designed for high school students. So Avneet and Parvinder and Kulpreet and everyone in the group came together, and this was a volunteer-led student-run program where we have high school students from 6 different schools, and they were taught what is addiction, how to help someone who is going through substance use disorder, and how to get resources if they have to for themselves or for their family members. And most importantly, we taught them what is empathy and how to be empathetic towards people who use substances. In addition to that, there were other workshops delivered by Kulpreet Singh on advocacy and how to start a nonprofit organization if they want to address mental health issues. So we were trying to mobilize them with knowledge and then and capacity building, and also helping them to understand that toxic drugs are circulating out there. And if their peers or if their friends need help, help is available in the community. And most of these students were first generation immigrant high school students who had this language gap between their parents and between their elder siblings. So we try to have a nice connective workshop where they were given terminology, how to talk with their parents, terminology, how to talk with people who use substances. And our peer with lived experience, Parvinder, shared his own journey with these students and shared what it looks like to be homeless on East Hastings Street for 1 year, what it looked like to be, or what it feels like to be a person with opioid use disorder. And this was a really something which was being done for the first time, where high school students were getting to know about this crisis in a very detailed fashion and know more about the resources out there in the community so that they can support other people as well. So this was a great success. And again, students like Avneet Dhillon, Sandeep Singh, Taideep, Yashmeet Kaur. So we have a lovely team of students who are working on ground to help our community in this crisis. And, sorry, yeah, go ahead, Kulpreet.
So in the topic of research, I just want to mention that research on South Asian communities is very limited, and I think that the attendees at this conference particularly may have an interest in research, and it's so important to engage with communities that have been historically marginalized and not included in research. A lot of times, like I mentioned previously about disaggregated race-based data, if you can't tell people stories, you don't know what gaps they're facing. If you can't tell people stories, you can't provide them the services that they need. And very importantly, if you can't tell people stories, if you don't have the data, if you don't have the research, you can't create policies. So Students Overcoming Substance Use Disorder has been doing amazing work in trying to create that research. And also, when I had an opportunity to work with Fraser Health on a community needs assessment, which was launched throughout the community, and SOTA was a great support in that.
Yeah, and again, highlighting the importance of research. For example, we have very limited research on how international students or temporary residents are exposed to substances such as fentanyl or heroin on the Canadian soil. So SOTA is doing another research project with Roshni Clinic's lead doctor, Dr. Natasha Puri, on understanding how international students and temporary residents are introduced to these illicit drugs on Canadian soil. And this is really important because SOTA has been trying to advocate for the rights of international students and other temporary resident workers, as you will see in one of the cases, which I am sharing in future slides here. And SOTA has been on the Legislative Assembly of British Columbia to advocate for the rights of people who use substances and people who are from marginalized communities. So we provided them recommendations in how to tackle overdose crisis in the South Asian community, because like one color approach is not helping our people. The needs and the needs of South Asian youth, the needs of South Asian homeless men, they're totally different from other communities, because this is a complex interplay of different factors such as immigration status, such as kind of food or type of food South Asian people eat, because if we are sending them to a food bank where they're giving them something which they have never cooked, that they're going to throw that because that will be not useful for South Asian people. So this is a very complex interplay of different social determinants of health, which has to be taken seriously. And SOTA has been working and trying to trying to bring out these hidden factors in front of the policymakers so that they can design policies effectively which can work for South Asian men. In
Next
addition,
slide, Gurkirat Singh, in the next picture slide after Avneet's slide, there's a picture of Sota doing naloxone training. And I think this is one of the very important things that needs to be highlighted, that during the pandemic, from 2019 until the present day, the Sota team has interacted with thousands of people in the community. When people were using pandemic safety precautions, the Sota team was still out in our local parks. They were out at our local recreational facilities, and they were educating people who were safely distancing at that time. And until the present day, you can see here that Gurkirat is pictured in here. Some of the other Sota volunteers like Karan and Jasmine are pictured in this photo. They're providing multilingual, culturally relevant training. And it's not only the mechanism of how to administer naloxone, but some of the concepts that might be new to community members, like what is harm reduction, or why is there such a gap in treatment? Like Gurkirat mentioned about food, it's not such a simple thing. Like Gurkirat mentioned, the culture, social determinants of health. When it comes to treatment centers, there's a huge gap in the provision of treatment facilities that are culturally specific. So while we engage in education in the community around these needs, we also engage in advocacy to our elected representatives for more funding and policy changes so that there are culturally relevant services available.
yeah, and in addition to that, we would also like to share some stories from our case management team, stories which we have been trying to work on. For example, in this photo, so this photo was taken on December 26th at 4 a.m. at the Surrey Memorial Hospital. So we got a call on the Christmas night when me and my brother were having dinner that, so this call again was from India by a mom saying that my son overdosed in a gas station washroom and his friend is reluctant to take him to the hospital because he is fearful that his immigration status would be compromised if he's taking his friend to a place where he can get some medical intervention, or a place where ambulance will come and they will be jeopardizing their immigration status. So our team went to the scene. We administered naloxone and we revived this guy and then took him to the Surrey Memorial Hospital. But unfortunately, the way our healthcare system works is full of barriers, especially for people from marginalized communities and people with limited healthcare insurances. For example, this guy was an international student and he was paying a student insurance fee to his private college, but that was not being considered by, that insurance was not being considered by our hospital system. So they were like trying to like tell us that you have to pay this like big sum of money, or like how are you going to pay it? What are like from where the money will come? Instead of providing care, they were like making this process very cumbersome. And eventually, when we got admitted in the hospital, the guy was doing okay. He was stabilized. Before discharging this international student, they didn't give him any resources or any particular OAT medications to cope up with his addiction, because he was going through opioid use disorder, and they discharged him without connecting him with appropriate clinics. So what happened again, the next day, this guy overdosed again. And imagine a 19-year or 20-year-old guy who has no family in Canada, living on its own, and has parents worried back home in their home country, what will happen to their young child. So this is one of the cases which really like surprised me that we can deliver resources and we can deliver services to everyone in Canada. But when it comes to international students or temporary resident workers, our healthcare system kind of like closes their eye, or they're not like treating them seriously. So another case, which is a success story, is our peer outreach worker, Parvinder Singh. So he had a really tough time, and I would like to spend my next. How are we doing with the time, by the way, Mahit?
We have about 10 to 15 minutes.
Sure, I will wrap this up pretty quick. So let me introduce everyone to Parvinder's journey. So Parvinder is the guy standing in the middle. So Parvinder Singh's story, I would say, is a testament to resilience and personal growth. From struggling as an international student to battling fentanyl addiction, I would say his journey, it reflects his determination to overcome these challenges and making a positive impact in the communities. So maybe first discuss the challenges which were faced by Parvinder. He came here as an international student, but on his work site, he was exposed to fentanyl by his peers. And then he started using fentanyl, which eventually led to opioid use disorder. And eventually he was homeless on East Hastings Street for 1 year. And in the meantime, his legal status in Canada as an international student expired, which led to more problems because with expired immigration status, he cannot access healthcare services, he cannot get any benefits, or he cannot get any work because as you know, like international students can work only 20 hours per week. But if they do not have their international student status, they cannot work in Canada. So this all led to homelessness. And he ended up living at East Hastings and being in that area without any cultural or language specific services. It was really tough for him to connect with the community, to connect with appropriate resources. But at St. Paul's Hospital's RAC clinic, one of the social workers, I would like to really thank that person. His name is Matt. I don't know if he still works there, but he was such a generous guy. He connected Parvinder with Soda. He connected Parvinder with Soda last year on April 9th. That was the first time I met Parvinder at Guru Nanak Sikh Gurdwara, where we were having our outreach booth. And seeing Parvinder in that condition, being homeless, not having enough clothes, not having basic necessities, which we take for granted, such as a cell phone, such as like proper shoes. So that really shook me from inside that what can we do to help Parvinder to be like a person like all of other international students or other people living in Canada, like a life with dignity. So then I reached out to other community resources such as South Asian Mental Health Alliance, One Voice Canada, Guru Nanak Sikh Gurdwara, and all of these community centers, they came together to help Parvinder. So he was having his Plan Z activated by St. Paul's Hospital, but then our role as a role of community organization was to help Parvinder connect with community and to take care of his expenses. So what we did, we divided this task into different pieces. For example, I was responsible for providing him a transportation compass card or making sure that he has a cell phone and it is working, and so that we can communicate with Parvinder because he was living on East Hastings and we are basically in Surrey. And then making sure that he's going to his appointments, he's going to his counseling sessions. And as you know, like counseling is not culturally sensitive at most of the places in Canada. So what we did, we requested Kamalpreet Kaur, who is counselor with who used to be counselor with Moving Forward Family Services, that can you provide some free counseling sessions for Parvinder because his condition was really vulnerable. And she agreed, and we started doing his counseling sessions separately with Kamalpreet Kaur. And eventually, when his period at St. Paul's Hospital's rec clinic and the hub got expired, so that he has to move to a new place. That was a very challenging time for our organization, because now we have to take care of his housing. And being a person without an immigration status, he cannot qualify for housing such as BC housing or other kind of housing supports which people with Canadian status usually get. So what we did, South Asian Mental Health Alliance founder Kulpreet Singh started paying his rent from his pocket. And we provided him stable housing, and his meals were taken care by Gurudwara, so that he can have 3 times meals at the nearby Gurudwara. So all these things started to fit together. And what we saw was an exceptional case, a person with fentanyl addiction quitted fentanyl when he had stable housing, good means of transportation, so that he can go and attend his like medical appointments. And then we transferred him from from St. Paul's hub rec clinic to Roshni Clinic in Surrey, where he was seen by Dr. Natasha Puri, who is an expert in addiction medicine. And now we were trying to build this safety net, build this community safety net around Parvinder, so that he has people whom he can trust, people with whom he can talk, people who can understand him. And you can see in this picture, so this is from October 2023, where Parvinder is leading one of our outreach booths and training other people in harm reduction, training other people how to help your loved one who is struggling with fentanyl or opium addiction. So we can clearly see that this underscores the importance of stable housing, some financial assistance, access to primary care, access to healthcare, and most importantly, emotional support. Because Pravinder came here as an international student, he didn't have any family in Canada. And we are also trying to help with his permanent residency. So we are now working together with the Immigration and Refugees Clinic in Vancouver, where we have a very nice person, Karen Zensen, who is working on his immigration status, so that he can have some kind of work permit or some kind of immigration status in coming days, so that he can work. He can have like other support services such as BC housing or other kind of services which are really crucial for people in recovery. Kulpreet Singh, would you like to add anything regarding this?
Yeah, as you can see on this slide, we've also outlined some of our partnerships with different organizations. So with the help of individuals like Gurkirat, Parvinder, and Sandeep pictured here, and all of the great community members who have supported Sama and Soda throughout the years, we've built partnerships with different organizations, and we've also sat on community tables or advisory boards to provide information on how to make harm reduction, substance use services, and mental health services more accessible to the South Asian community, whether that's the Canadian Mental Health Alliance Peer Assisted Care Team, which is a crisis response that's community led, whether that's FRAME, which focuses on youth mental health leadership building. We have engaged with Family Smart, as I mentioned earlier, on making resources so that families can have conversations. We sit on a leadership board with Foundry Surrey in Surrey North, and we'll also be engaging with the White Rock South Surrey Foundry that's being planned, so that we can make sure that, like Gurkirat mentioned, the international students and new immigrants who often don't know where to go and they don't feel safe in our traditional healthcare buildings will feel safe and will have people who speak their language. We've also engaged with Fraser Health. A couple of years ago, Fraser Health did some ad campaigns and, like I mentioned, did a community needs assessment. And Sota was actively involved in providing input into that. And we also sit on the community action teams, which are funded by the Community Action Initiative. I was on the steering committee for the Abbotsford Community Action Team, and we also participate actively in Surrey and South Surrey White Rock. just to make sure that wherever new immigrants or international students are present in the Lower Mainland, we can be a voice to advocate for more culturally relevant and language-specific resources. And we are always kind of beating that drum. We're always kind of being that squeaky wheel in those meetings across the board, whether it's with the Ministry of Mental Health and Addictions or whether it's with any other ministry, for example, higher education, to make sure that resources that are developed, websites that are launched, apps that are launched, brochures that are made are accessible to people in their language and are relevant to their culture.
And if we just talk about our impact in 2023 alone, we trained more than 250 individuals in overdose response and prevention training, distributed over 300 naloxone kits and harm reduction supplies. We presented at 4 research conferences, advocating for cultural sensitivity and addressing overdose crisis. We engaged in over 3,000 interactions with community members, and all this work, again, this is done by students, by all of us are volunteers in this organization. And we partnered with UBC grad student of NEET to conduct Step Forward with SODA. And again, connecting highly vulnerable youth to substance use treatment centers. Substance use treatments is something which we have been doing, and which is something I think like most of us can do, actually, like helping our family, helping our friends. And if you know someone who would like to need more resources, feel free to connect with us. And yeah, so we are really grateful of all our volunteers, all our community members who are supporting us, and the gurdwaras where we get a place to conduct these booths. So we are really thankful for all the love and support we are getting from community. And thank you all so much for attending this session and listening to us. And if you have any questions, please feel free to direct them to Mahip. We would love to answer.
Thank you so much, Gurkirat and Kulpreet, for giving us insight on some of the obstacles and barriers that the South Asian community faces while trying to access mental health services, and as well as the efforts you and your team are making to help these individuals. So we now welcome any questions